Introduction to Pain and Its Management, presented by Psychology and Neuroscience.
Pain is the most common reason for patients to enter healthcare settings, and the most common reason given for self-medication. Pain interrupts all other activity and arrests current behavior. It functions to prime escape or protective behavior. It is an everyday and frequent experience. There is a common understanding of pain that it is a useful signal of damage. Indeed, in the majority of cases, pain is a relatively reliable signal of damage. Pain is an unpleasant sensory and emotional experience associated with actual or potential tissue damage, or described in terms of such damage. Pain motivates us to withdraw from damaging or potentially damaging situations, protect the damaged body part while it heals, and avoid those situations in the future. Some people think that pain is a natural part of aging or illness, which is wrong. There is almost always a reason for the pain, and most physical pain can be managed. In addition to physical discomfort, chronic pain can lead to sleep problems and depression when pain is not treated. You also may feel overwhelmed by intense emotions of panic, grief, or anger. Early theories of the psychology of pain assessed global factors such as personality, gender, age, and culture. These global or broad sweep explanations seem to have an intuitive appeal, and one still hears them supported in everyday practice. The evidence in support of these explanations, however, is not always persuasive or conclusive. More recent areas of study have developed our understanding of specific physiological traits, or specific states of experience, that affect the pain and suffering. Fear, attention, emotion, avoiding tendency influence the experience derived from the pain. Pain may be expressed through fear, depression, and anger. Pain is always subjective. Each individual learns the application of the word through experiences related to injury in early life. It is unquestionably a sensation in a part of the body, but it is also unpleasant, and therefore also an emotional experience. It is important to realize that there are two distinct responses to a painful stimulus, a first pain and a second pain. The first pain is well localized and brief, the second is more diffuse and protracted. First pain is described as sharp and pricking. It localizes to a well-defined part of the body surface. The receptors for this first pain are high-threshold mechanoreceptors. There appear to be specific nociceptors which mediate pain, and only pain. Second pain is due to stimulation of receptors that exist in many tissues but not in, paradoxically, the brain. It is often described as dull and aching. This pain tends to last beyond the termination of an acute painful stimulus. Sources, pathways, perception of and treatment of the two types of pain are very different. Visceral pain is predominantly of the second pain type. Let us now try to understand the pain pathways. Pain pathways are nerve pathways through which the pain signal travel. You prick your finger on something sharp. This causes tissue damage, which is registered by microscopic pain receptors, nociceptors, in your skin. Each pain receptor forms one end of a nerve cell neuron. It is connected to the other end, in the spinal cord, by a long nerve fiber or axon. When the pain receptor is activated, it sends an electrical signal up the nerve fiber. The nerve fiber is bundled with many others to form a peripheral nerve. The electrical signal passes up the neuron within the peripheral nerve to reach the spinal cord in the neck. Within an area of the spinal cord called the dorsal horn, the electrical signals are transmitted from one neuron to another cross-junction synapses by means of chemical messengers, neurotransmitters. Signals are then passed up the spinal cord to the brain. In the brain, the signals pass to the thalamus. This is a sorting station that relays the signals onto different parts of the brain. Signals are sent to the somatosensory cortex responsible for physical sensation, the frontal cortex in charge of thinking, and the limbic system linked to emotion. The end result is that you feel a sensation of pain in your finger, think ouch. What was that or something similar, and react emotionally to the pain. For example, you feel annoyed or irritated. People develop pain for many reasons. Pain from a recent surgery, injury or medical illness is called acute pain. In many cases, this pain can be managed immediately, and will usually get better in just a short time. For more serious pain, however, your primary care doctor may ask a pain medicine doctor to help manage your pain while you are healing. If your pain persists after the healing process should be over, you might have what is called chronic pain. If the current treatment you are receiving stops working, or your pain begins to get worse over time, your primary care doctor may suggest that you see a pain medicine doctor. Cancer pain is another condition that can be managed by a pain medicine doctor, while the patient continues to receive treatment for various types of cancer. The pain can be due to cancer surgery or treatment procedures, including radiation therapy and chemotherapy, or the tumor itself. For thousands of years, doctors have been helping to relieve their patients' pain with a variety of medications and treatments. Like other areas of medicine, a new subset of doctors have become specialists in treating pain. They are focused on managing all types of pain, studying what causes it, how the body reacts to it, how different medications reduce or eliminate the pain, and how other treatments can be used to relieve many painful conditions. Doctors who manage pain are frequently anesthesiologists. Anesthesiologists are doctors of medicine MD or osteopathy DO, who make sure that you are safe, pain-free and comfortable during and following surgery. They also provide their services in other areas of the hospital, especially in the labor and delivery area or in doctors' offices, where painful medical tests or procedures are performed. Due to rapid advances in medicine, a wide variety of medications and treatments are available for acute, chronic and cancer pain. Patients often will be prescribed medications before receiving other forms of therapy. In addition, your pain medicine doctor may conclude that a combination of medication and treatments may be right for you. Your therapy plan will be tailored to your specific needs and circumstances. Common pain relievers. Non-aspirin pain relievers such as acetaminophen can relieve headaches and minor pain, but do not reduce swelling. They are sometimes used in combination with other drugs to provide greater pain relief. Anti-inflammatory drugs. Aspirin, coated or buffered aspirin and aspirin with acetaminophen may be used to reduce swelling and irritation as well as to relieve pain. There also are non-steroidal anti-inflammatory drugs and SAIDs, commonly called NSAIDs, such as ibuprofen. Anti-inflammatory drugs are used to relieve pain, inflammation and fever. There also are steroidal drugs like cortisol and prednisone, available only by prescription, that are used to treat more serious inflammatory conditions such as chronic arthritis. Opioid pain medications. Morphine-like drugs called opioids are prescribed to treat acute pain or cancer pain. They are occasionally used for certain chronic, non-cancer pain as well. Antidepressants. These drugs were originally used only to treat depression. Studies now show, however, that they also can relieve certain pain. Available only by prescription, They often are used to help you sleep better at night. Anti-seizure medicines. These medications are used to relieve what some patients describe as shooting pain by decreasing abnormal painful sensations caused by damaged nerves. Other medicines. The doctor may also prescribe other types of medication that will be helpful for your specific pain problems. In addition, medications that counteract the side effects of opioids or treat the anxiety and depression associated with pain may also be prescribed. Medication alone may not be enough to manage certain kinds of pain. Some medicines are more effective in fighting pain when they are combined with other methods of treatment. In some cases, the patient's pain condition may respond to treatment instead of medication. In fact, for some patients, certain therapies may eventually replace the need for taking any pain medicine, or less of it, over time. Here are just some of the available treatments being used successfully to treat pain patients. Injection treatments. Local anesthetics, with or without cortisone-like medicines, can be injected around nerve roots and into muscles or joints. These medicines reduce swelling, irritation, muscle spasms and abnormal nerve activity that can cause pain. Nerve blocks, often a group of nerves, called a plexus or ganglion, that causes pain to a specific organ or body region can be blocked with local anesthetics. If successful, another solution, that numbs the nerves can then be injected. Physical and aquatic therapy. The physiatrist or physical therapist may suggest an exercise program tailored for you, that will increase your daily functioning and decrease your pain. Other treatments may include whirlpool therapy, ultrasound and deep muscle massage. Electrical stimulation. Transcutaneous electrical nerve stimulation TENS is the most common form of electrical stimulation used in pain management. It is not painful, and does not require needles or medicine. TENS consists of a small, battery-operated device that can diminish pain by stimulating nerve fibers through the skin. Acupuncture. This ancient Chinese practice uses very thin needles at very specific points on the skin to treat disease and pain. Practitioners of acupuncture undergo specialized training in those techniques, and may offer this treatment for certain painful conditions. Psychological support. Many patients who are in pain feel the emotional effects of suffering along with the physical aspects of pain. These may include feelings of anger, sadness, hopelessness or despair. In addition, pain can alter one's personality, disrupt sleep, interfere with work and relationships and often have a profound effect on family members. Support and counseling from a psychiatrist or psychologist, combined with a comprehensive pain treatment program, may be needed to help you manage your condition. These trained professionals also can teach you additional self-help therapies, such as relaxation training or biofeedback to relieve pain, lessen muscle spasms and reduce stress. Surgery. When necessary, surgical treatment may be recommended. In rare instances when severe pain has not responded to other treatments and procedures, surgery on certain nerves can be done to give the patient some relief and allow them to resume near-normal activities. Usually all other avenues of treatment are tried before surgery is considered.